Hello, I Ashwin Torne from R.C. Patel Institute of Pharmacy, Sherpur. Today, I am going to discuss about sympathomimetic drugs. After watching this video, you will be able to define and classify sympathomimetics, remember various adrenergic receptors, understand effects of adrenergic stimulation, and explain the pharmacology of sympathomimetic drugs. Sympathomimetics are the drugs which produce actions similar to those seen by stimulation of sympathetic nervous system. The neurotransmitter present at the neuroeffector junction of sympathetic nervous system is noradrenaline or adrenaline. So, these drugs are also called as adrenergic drugs. After release of noradrenaline or adrenaline, combined with adrenergic receptors to produce its action, there are two types of adrenergic receptors. First one is alpha receptors, which are further classified into alpha 1 and alpha 2 receptors. Second one is beta receptors, which are further classified into beta 1 and beta 2 receptors. These receptors are present in various organs of our body. The effects which are observed after the sympathetic stimulation or adrenergic stimulation are again divided into alpha actions and beta actions, and it depends on which receptor the drug acts. Vasoconstriction of peripheral blood vessels of skin and mucous membrane, mydriasis, constriction of uterine smooth muscle, and contraction of intestinal smooth muscle are the effects observed after the stimulation of alpha adrenergic receptors. Increase in rate and force of contraction of heart, bronchodilation, dilation of skeletal blood vessels, relaxation of uterine smooth muscles and intestinal smooth muscles, increase in glycogenolysis are the effects observed after the stimulation of beta adrenergic receptors. These sympathomimetic drugs are classified chemically into two types. First one are the drugs which contains catecholamine nucleus in their structure are called as catecholamines. Examples of catecholamines includes adrenaline, noradrenaline, isoprenaline, etc. The drugs which does not have a catechol nucleus in their structure, these are called as non-catecholamines, and example includes phenylephrine and ephedrine. These drugs act by combining with the adrenergic receptors, either alpha adrenergic receptor or beta adrenergic receptor, or they may act on both alpha as well as beta adrenergic receptors. The effect observed after the administration of drug depends on the receptor on which the drug acts. Noradrenaline acts on alpha receptor only and will show the effects which are observed after the stimulation of alpha receptors. Adrenaline acts on the alpha as well as beta receptor and will show the effects which are seen after the stimulation of alpha and beta receptors. Isoprenaline acts on beta receptors only, and the effects observed after the administration of isoprenaline will be similar to the stimulation of the beta receptor. So, we will discuss the drugs one by one. First one is adrenaline. As it acts on both alpha as well as beta receptors which are present in our body, the adrenaline will show all effects which are observed after the stimulation of sympathetic nervous system. Adrenaline acts on the beta receptors of the heart and produces increase in rate and force of contraction, that is positive chronotropic and positive inotropic effect respectively. It increases the cardiac output due to the increased cardiac activity. The effect of adrenaline on blood vessel and blood pressure is different at different doses, since certain blood vessels contains alpha receptor and certain blood vessels contains beta receptor. In low doses, adrenaline acts on alpha receptors only, which are present in the peripheral blood vessels of skin and mucous membrane, which get constricted and which leads to increase in blood pressure. In higher doses, adrenaline first of all acts on alpha receptor, which is followed by its action on beta receptors. When it gets combined with the beta receptors, which are present in the skeletal blood vessels, the blood vessels get dilated, which leads to decrease in diastolic blood pressure. The net result observed after the administration of adrenaline includes at includes a rise in blood pressure followed by decrease in blood pressure. Its beta action is prolonged than that of the alpha action. Thus, we can say that the adrenaline shows biphasic response on blood pressure in moderate doses. Now, it's a question for you. What will be the action of adrenaline on blood pressure if its action on alpha receptors is blocked? Pause the video for 2 minutes, think over it and write the answers in your notebook. So I think you might have been written the answer in your notebook. So as we have discussed earlier that in low doses adrenaline activates alpha receptors, thereby causes the constriction of peripheral blood vessels, which leads to increase in systolic blood pressure. Similarly, in higher doses adrenaline activates both alpha as well as beta receptors. So, in higher doses, adrenaline first of all show the increase in systolic blood pressure due to its action on alpha receptors, which causes peripheral blood vessel constriction, which are present in the skin and mucous membrane. This action is followed by beta action, which leads to, as these beta receptors are present in the skeletal blood vessels, they get dilated and which leads to fall in diastolic blood pressure. So, if the alpha action of adrenaline is blocked by alpha blocking agent like ergotoxin, it will, and then if adrenaline is administered, then adrenaline will not produce the alpha action, that is, it will not produce the rise in blood pressure, but as its beta action is not blocked, it will result into the fall in diastolic blood pressure only. This conversion of biphasic action on blood pressure to monophasic action on blood pressure was first of all observed by a scientist Dell, and hence this is called as Dell's vasomotor reversal. Diagrammatically, these actions of adrenaline can be shown as follows. This first diagram shows the effect of adrenaline when it is administered directly to the patient. So, first of all, the adrenaline acts on the alpha receptors which are present in the peripheral blood vessels, which leads to constriction of these peripheral blood vessels and results into the rise in systolic blood pressure. This action is followed by its action on a beta receptor, and it results into the dilation of skeletal blood vessels, which results into the decrease in diastolic blood pressure. But when the action of adrenaline on its alpha receptor is blocked by administration of alpha receptor blocking agent like ergotoxin, then as the alpha receptors are blocked, after that if adrenaline is administered, then adrenaline will unable to produce its action on the alpha receptor, but as the beta receptors are not blocked, adrenaline will directly act on the beta receptors which are present in the skeletal blood vessels, which results into the dilation of skeletal blood vessels, due to which the blood pressure decreases. So, Here, the biphasic action, that is rise in blood pressure, which is followed by fall in blood pressure, is converted to the fall in blood pressure only. So the action is reversed, and this effect was first of all observed by scientist Dell, and hence it is called as Dell's vasomotor reversal. Other actions of adrenaline includes it causes relaxation of smooth muscles of bronchi, GIT, and uterus. It acts as a powerful bronchodilator. On central nervous system, it causes stimulation due to which tremors, restlessness, palpitation, and apprehension is observed. It also accelerates the glycogenolysis in the liver and produces hyperglycemia. Adrenaline also acts as a physiological antagonist of histamine, and when it is administered, it completely opposes the bronchoconstriction produced by histamine. It is also combined with the local anesthetics to prolong their action, and this effect is observed due to the peripheral vasoconstriction which is produced by adrenaline. Adrenaline also has certain adverse effects that includes palpitation, tremors, apprehension, hypertension, arrhythmia, acute pulmonary edema, etc. Therapeutically, adrenaline is mainly used in the treatment of bronchial asthma due to its action on bronchial smooth muscle, which leads to bronchodilation. It is also used in the treatment of acute anaphylaxis since it have tendency to oppose the bronchoconstriction produced by the histamine. It is also used in the combination with the local anesthetic to produce their action due to its peripheral vasoconstrictor action. This action is also helpful to control the hemorrhage. Intracardiac injection of adrenaline is also administered in case of accidental heart failure. Its action on the respiratory tract or bronchodilatory action is also useful as a nasal decongestant. So, this is all about the pharmacology of adrenaline. We will study the pharmacology of other catecholamines and non-catecholamines in the next video. So keep watching and have a happy learning. Thank you.